Hello, my name is Mandy, and I have chosen to talk about hyperthyroidism for my pathology topic. I chose this topic because my sister-in-law has Graves' disease, and I am a nuclear medicine tech, so I have worked with a lot of patients who have hyperthyroidism. So what is hyperthyroidism? Hyperthyroidism is when the thyroid gland becomes overactive and releases too much thyroxine and triiodothyronine. These hormones are also known as T4 and T3. You can develop hyperthyroidism at any age, but women between the ages of 40 through 60 are more at risk. Also, the chances of developing it increase if you have had a previous autoimmune disease or have had a recent pregnancy or have a high iodine diet. The thyroid is located on the anterior portion of the trachea. It is in the shape of a butterfly with two lobes on each side of the trachea that are connected by a piece of tissue called the isthmus. The thyroid is part of the endocrine system, and its main role is to release hormones, the T4 and T3 that we just talked about, that aid in metabolism as well as growth and development of the human body. The hormones that are released by the thyroid, T3 and T4, work together to regulate how the body uses energy. This energy goes towards metabolism within the body and also manages the heart rate and the body's temperature. Other hormones that aid in the release of T3 and T4 from the thyroid are thyroid releasing hormone, also known as TRH, as well as the thyroid stimulating hormone known as TSH. TRH is released from the hypothalamus and the TSH is released from the pituitary gland. The thyroid releases T3 and T4 hormones based on a negative feedback loop. The negative feedback loop involves the pituitary gland, the hypothalamus, as well as the thyroid. When T3 and T4 are low, the hypothalamus releases the thyroid releasing hormone, also known as TRH. TRH then stimulates the pituitary gland to release the thyroid stimulating hormone, which is also known as TSH. The TSH then tells the thyroid to pick up iodine, which is used to produce more T3 and T4. If the thyroid has produced too much T3 and T4, then the hypothalamus slows the release of TRH, which then slows the pituitary in releasing TSH, which then tells the thyroid to stop making the T3 and T4 hormone. This cycle is often what is broken when patients are experiencing hyperthyroidism. A patient may be experiencing many symptoms if they are hyperthyroid. The main symptoms being weight loss, irregular heartbeat, feeling hot, hair is brittle. They may have a goiter at the base of their neck, which may become enlarged, or bulging eyes. There are three main causes for hyperthyroidism. Number one being Graves' disease. This is the most common form of hyperthyroidism. It occurs from the immune system that produces antibodies which stimulate your thyroid to produce too much T4. Hyperfunctioning thyroid nodules is another form of hyperthyroidism. This can be broken down into different types, like multinodular goiters, also known as plumber's disease, or toxic adenomas. These occur when one or more adenomas of the thyroid produce too much T4. These are often benign. And in this image here, you can see the multinodular goiter in the bottom left of the right picture here. You can see that there's several hot spots within that thyroid. And then the one to the right there is the toxic adenoma, which is just a singular hot spot. Another form of hyperthyroidism is thyroiditis. This occurs when the thyroid becomes inflamed after a pregnancy or due to an autoimmune condition. Thyroiditis causes the stored thyroid hormone to leak from the thyroid into the bloodstream. This can be painful, unlike the other forms of hyperthyroidism. And you can see in that same picture where it's labeled thyroiditis on the top right there, how you can't see it, and that's due to the fact that there is no more of that thyroid hormone. It has left the thyroid and into the bloodstream. There are several tests that can be done to determine if the patient has hyperthyroidism. The first one is usually blood tests. If the patient has blood work done and it comes back low in the TSH hormone and high in T4, that is an indication of hyperthyroidism. Another test is the thyroid uptake and scan. After a patient has had blood work that indicates hyperthyroidism, the doctor may order an uptake and scan to determine what is causing the hyperthyroidism. This is done by having the patient take a pill that has a small amount of radioactive iodine. The patient comes back at the 6-hour and 24 hours after the pill has been taken and is measured with an uptake probe to see how much of that iodine was taken up by the thyroid. The more iodine that has been taken up by the thyroid, the more hyperthyroid that patient is. The patient also has imaging done after they have been measured, and this will show if there are any nodules. The patient can also get a thyroid ultrasound done, and this will also identify any possible nodules. There are three main treatment options when it comes to treating hyperthyroidism. The first being medication. This one is often only used for people who have Graves' disease. The patient can take an anti-thyroid medication like methimazole. This often works for a couple of years, but if the patient doesn't become euthyroid, which is a normal functioning thyroid, within those couple of years, they will most likely need a different treatment. This medication is not something that should be taken for a long period of time because it can cause issues with the liver. Another treatment is called a radioactive iodine therapy. This is a therapy where the patient takes a pill that has iodine, which is tagged with a radioactive isotope called I-131 or iodine-131. The thyroid takes up the iodine and the thyroid shrinks and becomes less active. In most cases, the patient may become hypothyroid and will need to take a medication to replace that T4 hormone, which is lost. There's a lot of prep that comes with this therapy. The patient will most likely have to be off of their anti-thyroid medication for at least 4 to 6 weeks, unless they receive a shot that is ordered by the doctor that allows them to continue their medication. The patient must also be on a low iodine diet. The patient will also have to isolate after the pill has been taken for at least 3 to 4 days, as they will be radioactive. It is a good idea to have their own bathroom, as well as sleep in their own bed and use their own utensils. The radiation exits their body via urine, saliva, and sweat. And they also must maintain 6 feet from relatives, children, animals, as to not expose them to the radiation. This treatment does not make the patient feel different. The only symptoms that they may have are a sore throat that should only last for a couple of days. Another possible treatment is a thyroidectomy. The patient can opt for a complete removal of their thyroid, but this is a more risky option due to the proximity to their vocal cords, as well as nerves around that area. There's also other complications of it just being a surgery, general surgery complications. The patient will have to take medication to replace the thyroid hormones, as well as taking medication to replace the hormones that are lost from also having their parathyroid glands removed. As a side note, if the patient has had severe eye issues due to being hyperthyroidist, they may need to have a surgery or a treatment for that as well. Here is my reference page, and thank you for listening to my presentation.